You don't always have to go under the knife in order to achieve that well-defined contour on your face. So let's talk about non-surgical facial contouring. Hi, I'm Dr. Peter Chng.
I'm Dr. Loo.
I'm Dr. Chng.
So what exactly is non-surgical facial contouring?
So non-surgical facial contouring is a minimally invasive procedure that redefines, reshape, and lift facial features and offering results like a sharper angle or a lifted look with minimal downtime and lower risk as compared to traditional surgery.
Yeah, that's why I think nowadays people are trying to stay away from surgery. Our patients all come to us and then we tell them about all these options. But when it comes to surgery, right, everyone was like, oh, no. Right? So I always tell them that if for example, some of them have very saggy skin or very saggy eye bag, that's the thing that we cannot use all this non-surgical method. Eventually, you need surgery, So then we refer to the plastic surgeon or the oculoplastic to do all those jobs, But until then, I think this non-surgical facial contouring are the methods there are many methods that we can offer the patients to achieve that contour of the skin. Like you said, very minimal downtime, and at the same time, they can still get the contour, the well-defined cheek, improve the saggy skin, the nasolabial fold, all this.
Yeah, and it's popular because it offers immediate or gradual results with little downtime, lower risk, and it focuses on natural enhancement rather than drastically altered look.
Yeah, so natural is another thing. A lot of this non-surgical facial contouring, the results, patient will just tell me, my friends just ask me, how come I look so fresh? How come I look more alert compared to those days? It's not like, hey, what have you done to your face, that kind of thing. So I think surgical has that disadvantage because even the now mini facelift, whatever, it's pulled in a certain angle rather than, let the natural skin and natural muscle of the patient tightens to that specific angle, the natural angle.
Yeah, I think patient doesn't want to look fake, basically.
Yeah. So what are some of the options for non-surgical facial contouring?
So one of the options is Dermal Fillers, which is the injectable gels to add volume to the area with age-related collagen or fat loss like under the eye, temples, and sagging cheek. It also helps to plump up this area, like soften your nasal labial folds and enhance your facial features, like plump up your lips and the more sharper jawlines.
Yeah, but what we are trying to achieve is to correct, those volume loss and not trying to change the look of the patient, right? It's not like we're going to make the patient's cheek higher or whatever from its natural look, right? Or, I also don't like if a patient's chin is just that size and then suddenly we're trying to elongate the chin. It just doesn't look natural.
Yeah, it's actually more of like, what is the problem of the patient? If it's volume loss, then we have to fill the volume. We are doing like thread lifting is one of the way of we are doing like minimally invasive procedure. We can't actually replace the volume loss with the thread lifting. We can actually we need something else. So it depends on what is the problem.
I always tell my patient that although it has a drastic immediate effect, after doing it you immediately see the results. But the problem is it doesn't last, right? The most, like for lifting of the face and everything, the most you can achieve is 9 months, 10 months. Although some of the trades companies, they claim they can go 1.5 years, 2 years, In my experience, I've never seen something that can hold for so long, right? And of course, the downtime of thread lift is always at the entry point there'll be a dimple there because you need some place to anchor to lift it up. So at that point, then there will be the downtime at the dimple. But eventually it will go away, the dimple. But we also do thread lifting for nose. That some people have a lower nasal bone. They want to have a higher nasal bone. So thread can also be inserted as a volume to lift up the nasal bone. So what are the energy-based devices that can be used for facial contouring?
So energy-based device like microfocus ultrasound or radiofrequency, it heats up the deeper layer of the skin to stimulate for collagen and the elastin productions. For example, Ultherapy uses microfocus ultrasound to lift and tighten the skin by stimulating collagen production deep underneath the skin. So the handheld device is used to deliver the microfocus ultrasound precisely at a targeted depth And this ultrasound energy will create heat, which will heat up the underlying tissues to a specific temperature, which will then promote the collagen remodeling.
Yeah. We know that Ultherapy can also target this deep layer, we call it SMAS. It's a thin layer of muscles. And traditionally, the surgeons will tighten these muscles for facelifting, so surgical facelifting. But again, like it's to the one direction only, that where you pull, right? But when you're doing Ultherapy, it's actually diffuse. You are actually heating up the whole SMAS layer because there are multiple spots that we heat it up. So that's why it's more natural kind of lifting.
Another type of energy device that we commonly use to tighten the skin is actually radiofrequency. So there are two types that we commonly use. One is using the microneedling, another one is without the microneedling. These two types actually is quite different. Microneedling actually we use a needle to deliver the radiofrequency into the dermis layer and then stimulate collagen. This one comes with a little bit of downtime. So because they are using needles, so sometimes patients have some pinpoint bleeding and then some little bruising, but it's a very minimal. You can cover with your makeup.
We tighten the skin also, but we can also tighten the fat also, right?
Yeah,
so
we
that's
can
why
also go
we can go deeper in. So some patients have some fat, bulky fat there. If you want to tighten the fat,
we can debulk.
So go in 4 millimeter and really tighten the fat. So besides tightening the skin,
yeah, we can debulking the skin,
the
fat
face.
as
So
well.
that's why you can have a V shape of the face, because you create this contour according to each patient. Of course, we don't want to tighten the fat where actually the area where you need the fat, like at the lateral cheek. If you go and tighten the fat there, then you have a sunken cheek. Then you will look weird as well. Right? So we must know where to tighten and where not to tighten. Right? So the non-micro needling, the advantage of that is some patients really don't like needles. They're so afraid of although it's micro needle, but still they're so afraid of it. So the advantage is there's no needles there. But at the same time, they deliver the radio frequency. The disadvantage is it can't go as deep as the microneedle. So it can tighten the skin, it can have some contouring, but it cannot go as deep as that. But it's still helpful for patients who wants to have a well-defined jaw, lifted cheek. What about botulinum toxin?
So Botox can be used to be injected to masseter to slim down a square jawline. So these neurotoxins will temporarily block the nerve signals to this chewing muscle, which will then prevent it to contract forcefully. So this in turn leads to the reduced usage, and the muscle will gradually shrink, and eventually leads to the muscle reduction in the bulk, and this will slim the lower face. So visible results will be seen around 4 to 6 weeks, and future touch-up may be needed in another 4 to 6 months later.
There are some patients also, who grinds their teeth at night, right? Unconsciously. So they always say the dentist will tell them they have very thin enamel because of their grinding at night. So it is also useful for them, because you kill two birds with one stone, right? First, you reduce the muscle, you have less grinding on your teeth, it improves your teeth health. At the same time, you get a control of that. But we know botulinum toxin is not permanent, right? It can only last 6 months for these muscles. So every 6 months, patients should come back again to repeat the procedure.
But some of the patients, after they injected for quite a long time, the muscle get atrophy. They actually required Botox less frequent. They can last longer.
There is no single treatment that is suitable for all patients. We have to look at what patient wants, what kind of contour that the patient wants to achieve, whether the patient has saggy skin, whether there's volume loss, the age of the patients, the elasticity of the skin, and whether the patient is scared of needles or not. So there are many methods to be able to address your concern. Talk to your doctors to decide what is the best treatment for you to achieve the ideal contour for your face.